You're listening to Addressing Gettysburg.
Hello, ladies and gentlemen. Welcome to this episode of Addressing Gettysburg. Today, we have our buddies Rick and Fran back on the show. That's Rick Schroeder and Fran Feyock, for those of you who are new to the show. And we are talking about Civil War surgical M&M. Chocolate covered in a nice hard candy shell. When a doctor, a lot of people don't know this, in the Civil War especially, when a doctor was operating, the nurse would often feed him M&Ms. And he would, yell, sponge, clamp, M&Ms, and then she'd put them in his mouth. And so, no, that's not what it is. It stands for morbidity and mortality, okay? We're not talking about chocolate. And so today, we're going to go through all this stuff. I think those of you in the medical field in the audience who always like these medical shows are really going to enjoy this one here. For those of you who know some of the figures that we're talking about, I think you're going to find it a little more interesting to hear about what happened to them. So, Fran Feyock, Rick Schroeder, welcome. Hello, gentlemen.
Welcome back.
Glad
and
to be
what?
back.
If a doctor was asking for M&Ms, I've worked with enough. It wouldn't be M&M, it'd be red M&M, green M&M, red and green M&M.
The
Am
specific.
I right?
Yes. Should we explain what an M&M is, Fran?
No, but you can't. Damn it, I wanted peanut M&Ms.
So morbidity and mortality, which is what M&M stands for, is a type of medical conference that every hospital has. And it's a very, very valuable meeting because it's a meeting where we sit and talk about things that didn't go very well.
All right, okay.
And I hope it's not news to the world that listens to this podcast, but the real world is, things have problems in the real world of medicine, and the whole point is to learn when things don't go well, just like life in general. And so morbidity means suffering. Mortality means death. Mm-hmm. And it's an opportunity for us to honestly talk about the problems we've had with certain cases, management of certain cases. And it should be one of the most valuable conferences in all of medicine because you get a chance to learn from other people's bad outcomes. But that's what morbidity and mortality stands
And more importantly, every state has laws that protect that conference from being used in a court of law.
Okay.
Because they realize that if you're going to talk about a bad outcome, that's what the attorneys in the world look for.
Sure.
This conference says you can't use this, and I don't know, Rick, do you think it gets more honesty out of people a little bit?
I think so. One of the problems...
I would imagine so.
Yeah, one of the problems that I saw in my career was people are often afraid to look bad. Mm-hmm. And so I think there is a tendency to sometimes not go where you're uncomfortable. That's human nature. But most of us who did the job that Fran and I did realized that everybody's better off if you talk about these things.
Sure, you learn from each other.
Absolutely.
Yeah. Okay, so when all right, well, let's start off with the role of adrenaline.
Okay, we're gonna discuss some personalities in the Civil War that have unusual things. One of the reasons we can talk about it is for this chemical called adrenaline. We all still have it floating in our system. Whenever you're under stress, even today or back in the Civil War, when bullets are flying, your body is still a primitive animal. Your brain reacts to things that you're not even aware of. Adrenaline is one of the ways it does it. When you're afraid, when you're in a car that's speeding out of control or spinning on ice, your hindbrain reacts way before your conscious brain. So it pushes out this chemical called adrenaline. First of all, you're not aware of it, but adrenaline releases sugar into your system for energy, starts to shunt blood to your heart and your brain so you can make quicker decisions. That's why your hands get cold and clammy, right? You don't recognize all this happening. Heart rate goes up, your pupils dilate to take in more, your hearing gets more. All this is happening before you know it. We know it as fear. We're coming up on Halloween, I think, when this will be released. Yeah. You know that fear that you get when you're on a haunted house or you're walking in a maze or you're lost, that's adrenaline pumping through your system. So we're going to talk about some figures today that have pretty traumatic injuries. Some survive, some don't survive. But the reason we can talk about it is the fact that this chemical that's inside everybody's body is pumping. Your liver works better, blood is shunted to your muscles, fight or flight. The adrenaline is what's happening, and as we go through some of these, we'll be able to notice that you can't pump out adrenaline forever.
Does adrenaline have any pain-killing properties?
Not that I'm aware of.
Yeah, I wouldn't say directly pain killing.
Right.
It can numb your senses, so maybe the pain isn't quite so severe because the priority becomes fight or flight, survival. And that's what the chemical is doing to your system, is ensuring that you can survive the stress that you're going through.
Because you hear these stories of these guys not even knowing that they're hit.
Correct. Right. And that's a response of the nervous system initially. But we use adrenaline in various forms. Epinephrine for people that heart stops. When you see the old Squad 51 epinephrine, that's adrenaline, that we can refine it and use it. The problem is using it burns out your system. You can't use it forever.
Right. So I always wondered that with the adrenaline shot. If your heart has stopped, there's no blood pumping. So how does giving you a shot of adrenaline do anything if the blood doesn't go through your system?
Well, where's it going? Right into your heart. And
but the heart's not stopped. It stopped.
Yeah, but all the cells around it can still get the effect of the adrenaline when you inject it into the muscle.
It makes your heart, if you will, more irritable and more likely to jump back into a rhythm that then maybe you can shock people out of.
It's like getting a cappuccino when you really aren't sure you're getting it. You go, whoa. And then at midnight you're going, why can't I see my hand? Same thing.
Okay, gotcha there. All right, so let's start talking about some of these guys. Let's get one of the more famous ones, well, not out of the way, but we'll start with him. Louis Armistead.
Well, let's before we start, Rick and I, a couple of things when we started to do these. We kind of try to look at them from the perspectives as we were preparing for a surgical M&M. You can't go into a surgical M&M and not be thinking about facts and figures. Unlike what happened with COVID-19, where there was a lot of rumors and innuendos, what we do different than most people who look at injuries, we try to go to what we call a primary source document. I don't know, Rick, how would you define a primary source document?
Well, it's like any historical document. You want to go back to as closest to the event, if you will, the ORs. When we talk about history, we're talking about medical documents that accurately depict what happened to the patient at a moment in time. And so we're either looking for medical reports, surgical reports,
first-hand
accounts of what happened to the patient, if you will. Those exist, and they exist for a lot of these Civil War guys. You just got to go find them.
And then are they easy to find? Like the guys we're going to talk about today, was it easy for you to find them?
It depends on where you go. Sometimes they're hidden in the OR or regimental reports.
So they're not. There isn't one place to go and find them.
Correct.
Interesting. Okay.
And also, after we get them, then Rick and I get the opportunity to drink scotch and wine and look at it going back in 2020. And sometimes it's not what's being written, it's what's not being written.
Right.
And that's where we kind of have the fun, and that's what you're going to see, maybe a little more than you want to know, but we've challenged some things that we've believed in history, and we pretty much find we're pretty much on target with them, which is kind of interesting.
Is there a lot of scotch and wine involved with
It depends.
Just enough.
So Louis Armistead.
What scotch do you like?
Yes.
Yeah.
Highland Scotch, send a bottle. Highland.
Okay. All right. So go ahead. Louis Armistead.
So Louis Armistead, we all know he's brigadier in Pickett's charge, and he gets wounded in a couple of places. He's taken to the Spangler farm, and he dies several days later. History says he dies of exhaustion. There's that quote where he pulls out a handful of corn and says, a man can't survive on a handful of corn. Well, exhaustion sounds like a really good idea, but we started looking into the medical records about Louis Armistead. Interestingly, he's going to be buried twice, we think, on the Spangler farm, in a blanket in the back of the barn, according to Stork, and in a rough box in the Confederate part near the 11th Corps and near the garden. So like every good Civil War story, we know he's put into the ground. We're just not sure where. He'll end up at Old St. Paul Cemetery in Baltimore. Right. Now, he has a military history that we know about, but Rick and I look at the past medical history of this guy.
Yeah, okay.
All right. Armistead is going to be, is he 46 here at Gettysburg? But his medical history, thing in there that will kind of put to it, he has a severe case of erysipelas, requiring surgery to remove his infected skin. What's erysipelas?
Erysipelas is an infection basically similar to flesh-eating bacteria that we know now, but it's a little more superficial in the skin. It's an infection from what's called a strep bug, and it goes all through the skin. People get very red. The skin peels off of them, and it can be life-threatening if it goes into the bloodstream. But it's an infection.
Right. So, say the name of it?
Erysipelas.
Not syphilis. Okay, I thought you said he had syphilis. I was like, whoa.
No, he might. No, he didn't. That's
You can still get that
APL.
today, right?
Yeah.
You can still get that today.
Oh, yeah.
Syphilis?
No,
Erysipelas.
Erysipelas as well. Yeah.
If you're not careful.
So now this was before Gettysburg, is what you're saying. He didn't have this at Gettysburg.
So when we look at these people, we try to go back into their history.
Yeah,
to see
that's
if
a good
there's
idea.
anything that would contribute to what we believe is going to happen. So in this case, we were looking for anything vascular-wise. He doesn't have anything. He's wounded by a knife in Kansas, but nothing big. But on July 3rd, he gets rifle wounds to the fleshy part of his right arm and leg below the knee. That's
His
how
left leg, his right arm.
left leg and right arm.
Fleshy part.
Now, Dr. Daniel Britton, surgeon at the 11th Corps, writes, and this is a quote from him, "Not believed to be mortal. None of these wounds crushed bone, artery, or nerve." So right away, Rick and I start going like, dude, what's going on?
Yeah.
So these are soft tissue wounds. And really, they should not have been the cause of death.
Right.
Okay.
Now, Dr. Britton's good. If one doctor has a good opinion, two doctors will be even better. Now, another doctor, Dr. Harvey, is going to examine Armistead after with him because I guess he's a general. And they both concur that these wounds are, they say the ultimate word that you should never say, these wounds aren't mortal, General Armistead. Right?
Right.
So, again, he's our Mormon friend to friend. He's going to die on July 5th. 1863. Time of death is controversial. Wayne Mott's helped us with this a little bit. 9 a.m., 10 a.m. Did they find him dead in the morning? He's just not going to see July 6th. That's what I tell people.
Okay.
So when you take those times and you put them together, the time from his wound to the time of his death works out to approximately 46 hours.
Okay.
Not even 2 days.
Almost as old as he is.
Right. So the death, and the death is just written by Dr. Britton afterwards. He said the death was not from wounds of July 3rd directly, but from secondary bacterium, fever, and prostration. All right, Rick, you're the doctor. Translate that for human talk.
Yeah, what is
Okay.
prostration?
Prostration just means you're wiped out and tired.
Gotcha.
But I don't think that these wounds would cause a serious infection in that short a period of time. Infection takes a few days to really come into place.
Okay.
And we need to also acknowledge that, like everything in the Civil War, if you look long enough, you're going to find 5 different sources that have different information. And in Ron Kirkwood's excellent book, Too Much for Human Endurance, he's got a whole chapter on Armistead's wounding. There are some poorly documented accounts that he suffered an undiscovered chest wound. That doesn't seem very likely. I mean, that would be really serious.
Yeah. Right.
So I think Fran and I are pretty convinced he's got soft tissue wounds,
Soft tissue wounds that shouldn't have killed him.
to his arm and his leg. Now,
But he's still dead.
yeah,
Right. Yeah, he's dead no matter how he died.
So this is
Right.
what Rick and I will sit there and start looking a little bit further. He's wounded. We know he's put into the summer kitchen. And I think in the new book, Ron's going to tell us exactly where in the summer kitchen. He's laid there, all right, and he's laying there. And Britton said, not from the wounds directly and prostration. We can both agree that that seems to be correct.
I think the key is he's been shot in the leg and he's not moving.
Right.
And he dies suddenly. Britton talks about
Right,
that.
he
He's
says-
not expected to die from these wounds, and very suddenly he's dead.
Astonished is what Britton
Yeah.
says. So this is where Rick and I look for what's not there. He doesn't describe any acute bleeding. We needed to apply
Yeah,
a
he
tourniquet.
didn't-
No mention of dressing changes, soaking through. No presence of pus or discharge like he's infected. And Rick, it's probably too early. He's probably
I think
infected
so.
but not showing to this thing.
Maybe.
So in modern medicine, what we think that he died of is a thing called a pulmonary embolism.
okay.
Now, pulmonary embolism, or PEs, occur when a blood clot from your legs travels to your lungs, shuts off your lungs, takes the oxygen away from your whole body, but primarily your brain, gives you about 4 minutes till you die from a PE. And when we see it in modern medical stuff, Rick, what do we hear? Suddenly, unexpectedly, didn't expect this, was doing well. So we started looking down the pulmonary embolism deal. And we start to find out, and Ron Kirkwood's going to back us up on this, that when you start to get a pulmonary embolism, it can be sudden or it can be growing upon itself. So a little blood clot becomes a medium, becomes a full one. So his lungs are essentially choked off. And over this time, you don't get enough oxygen to your brain. So Ron says he has things of General Armistead being a bit wild, a bit rambunctious.
Well, and as you don't get enough oxygen, you often become agitated and confused. And it's one of the things in the medical field, when people's behavior changes very unexpectedly, one of the first things you have to do is make sure that their blood oxygen level is okay.
Okay.
Right.
And the fact that he wasn't mobile, he was shot in the leg, and he's middle-aged, if you will, at 46, and he's laying around, and he dies suddenly. There's only a couple things that will kill you suddenly, and they all have to do with circulation. Either a heart attack, a blood clot, a stroke, but...
Sudden bleed somewhere.
Right.
You know.
Yeah.
Okay.
And it's our feeling that Armistead, you have to have a medical reason to put on the death certificate. Broken heart doesn't cut it. Exhaustion
Well,
doesn't
in
cut
1860.
it. I know. But
You and I would be saying,
but
come talk to us.
this still happens to people in hospitals. Many of the listeners may know of people who went in for an elective orthopedic knee or hip replacement and then got really sick or maybe tragically even died.
Yeah.
As orthopedic surgeons, we give people blood thinners to try to prevent it, but you can never prevent it completely. And in my mind, it's very clear. Every time I have a tour who has a nurse or a doctor on it, I'll put this case in front of them. 47-year-old guy shot in the leg, laying on the ground, not moving around, dies suddenly in 48 hours. Every one of them look at me and says, he had a pulmonary embolism.
Okay.
So it's pretty. No, Rick, it still happens. What's the percentage? Less than 1%.
About a 1 to 2% chance of getting a blood clot after a hip or a knee replacement.
So it's low.
Yeah, and dying of it is even much lower.
Yeah. But is that why they put those those things that inflate on your legs?
Yeah. To compress the muscles and the veins so the blood is still pumping up and down.
And we have surgery. We can go in and pull it out with radiology. I did one case in my career. We did open heart surgery and literally pulled the clot out of the arteries to clear it. So
how big are they?
I know the clot we pulled out of the arteries was as big as your index fingers.
Okay.
And they were perfect casts.
Yeah.
And it was a poor kid with Down syndrome who had no idea what was happening to him, but he got out of the hospital. I'm sorry for all the nurses listening to this. Louis Armistead died because he didn't have a son of a bitch nurse.
Who got him moving.
They came into that kitchen and said, I know, you're a big general. Get your ass up. We're going to walk. My leg hurts. I know. To the barn and back. And when you people go to hospitals and they say, oh, no, here comes physical therapy. Yeah. Think of Louis Armistead because that's what he needed.
That's a good point. I'm going to think about that if I'm ever in the hospital.
Yeah.
All right. So we believe then Armistead was a pulmonary embolism. Mm-hmm. Okay. How about the next guy, Dan Sickles?
Well, Dan Sickles.
Is Jim Hessler on the line?
Should we call him?
As our listeners know, Dan Sickles didn't die of his wound. There are probably a number of people who think he should have, but he did not. Dan Sickles is on his horse down by the trestle barn late afternoon, July 2nd. He feels a thud in his right leg. And his account, to your question, Matt, his account says, I really didn't feel any pain. But he reached down inside of his boot and pulled his hand back, and it was covered with blood. And when he goes to get off the horse, his leg isn't really doing what it's supposed to.
Yeah.
And Sickles himself writes, and I think this has been reproduced in a number of locations, that I was hit both above the knee and below the knee.
Right.
He's gotten off his horse. His staff put a tourniquet on his leg to stop the bleeding. And again, depending on the sources you read, his leg may have been badly mangled, almost akin to what Bayard Wilkinson's leg was like on the first day, who allegedly completed his own amputation with a pocket knife,
Right.
if he really did that. There may be some evidence that that was actually done on a rock down by the Trossel farm, by his staff, or by the surgeon. Or
Wait, what was done by it?
The amputation was completed by cutting the little bit of muscle that was
Take
left.
it easy,
For
Jim.
Sickles.
Take it
for
easy.
Sickles. Yeah. I mean, this was a pretty badly mangled leg.
But so, and then what? He was brought back to the hospital to complete everything, and
He had a surgery out at the Schaefer house, which is out by the current day outlets. But he didn't have the amputation there. He had the amputation closer to the site of the injury, either at the injury scene or at a farm, maybe on the Tawnytown Road.
Okay.
But he was transported out to the Schaefer farm, and a surgery was done there, probably to clean it up and wash it out, which is
And chill
what they
his
would have
champagne.
done. Right.
right.
But you know what? It shows you, can you have surgery without anesthesia? If the leg is mangled bad enough, you can. Rick, tell him where you think the leg was mangled.
Well, he was hit above the knee and below the knee, and when you look at his pictures as an amputee, his leg is clearly amputated above the knee.
Yeah.
So it's my feeling that he probably had the amputation done through the fracture above the knee.
In his femur.
Yeah, through his femur. Now, if you look at the specimen that's in the museum, it's only from the knee down.
Right. I was going to say, that's not a femur.
No, it's his tibia, his lower leg.
That's exactly what I was going to say, his tibia.
Right. And you can see from the specimen, there's a lot of bone missing in the middle of that leg. But again, when you look at him as a picture afterwards, his leg has been amputated well above the knee joint. Now, I think it's also very interesting that I've never seen a picture of Sickles wearing an artificial limb.
Yeah.
He endorsed an artificial limb and took the check, but he never, that I know of, wore it.
Thank you, Dan.
Well, he probably wanted everybody to have no doubt that he lost his leg in the war.
Well, I
Sickles
think
swinger.
it's
Probably really
waving,
uncomfortable.
It's also
Probably
uncomfortable.
like incredibly uncomfortable.
Well, when we
That-
talk about amputations, I hope we get a chance to. We'll talk about that because
Yeah.
that's absolutely right. The only reason you're going to wear an artificial limb is because it makes your life better and you can function better. Not that it looks better because now you got something in your pant leg.
Right.
Yeah. And Sickles survives this wound, and he's fortunate that it didn't get infected because 4 out of 5 surgeries got infected. There's no evidence that Sickles' leg ever got infected. By the time he's back in D.C. on July 5th talking to President Lincoln, he's well on the road to recovery.
Maybe he spit some tobacco juice on it.
From his cigar?
Could be. But sometimes, like when we went to look at the rock behind the Trossel farm, if his leg's mangled above the knee, they may have had to amputate it if it's hanging by a thread because it might be too angulated to get him off the field.
Yeah,
If
yeah.
your leg's laying at 90 degrees to your body,
Right.
You can't put that in a stretcher.
Right.
You know.
Yeah.
hard to splint.
Hard to
It's
split.
very difficult to explain. Now,
So, and then also, I'm guessing that if his leg was that badly mangled, a simple, let's say, pocket knife cut through it all isn't really going to be that painful.
That's correct.
You're probably not feeling much of that.
No.
Right? Because that's all just ruined
yeah,
from
it's
the wound. But
it's-
how did he get it? I'm sorry. Go ahead. And then I got a
you
question.
go ahead, Matt.
How did he? Was it a solid shot that we hit him, or how did he get it above and below?
I don't know that I can explain that unless somehow it hit him above the knee and then ricocheted down and hit the
Down.
lower leg. I don't think when you look at the specimen that a piece of shrapnel would have caused that much damage.
Yeah.
So I'm left to the conclusion that it was a solid shot. Whether it was one shot, I doubt if two.
I mean, that's a lucky two
Yeah.
shots.
Yeah.
I don't know. That just doesn't. That doesn't compute to me because in my estimation, right? If you have a solid shot from even a 3-inch rifle, that is a lot of kinetic energy that's being imparted
Yeah.
to that tissue. How in the name of God would that hang on at all? Like, why wouldn't that bone
the horse
fragment
absorbed some of
just
the-
be vaporized?
Yeah. Did the horse get hit?
No, the horse wasn't injured, from what I understand.
So, and so was this a glancing blow, or
Well,
was
it was
It
a-
couldn't have been direct.
I think it was fairly direct straight onto him, but what to what Eric says, I mean, we have many accounts of guys' arms and legs being ripped off by solid shots.
sure.
So why it wasn't in him? Maybe in essence it was ripped off, and you've got a few little strands of tissue that remains. We're still left, though, trying to explain how the injury below the
And we thought about, did the shell spin when it hit him? Did it... Did it
tumble. If it was a conical.
We don't know. I don't know, Jim, if you're on the leather boots, did that help? Remember, this is such an instantaneous injury.
Right. And do we know where? Know where he was, but what direction was he facing?
In my impression, he was sitting on his horse, looking to the west or to the southwest, where the peach orchard was.
Yeah, that's what I always thought.
And I don't know where the shot came from. Whether it had to be coming from the west, from the Confederate line, but. Did it? If it came in from his side, you would expect it to have done more damage and injured the horse.
The horse.
Again, it's my understanding that wasn't the case.
In my memory or in my imagination, it's coming from somewhere in the direction of the peach orchard, and glancing it's on its obviously descent, right? And it's almost about to land wherever it's going to land. So it's coming down at an angle. It's not a direct shot at him, and maybe it was like a perfect storm of things where he turned the horse just as it was hitting, and that's why it's that weird type of two wound. I don't know.
And the knee, for the most part's intact, in your opinion, right?
Yeah.
The knee joint's intact, which we sit there and look and say, how did that happen?
Yeah.
Like, why isn't the knee a bunch of...
Well, now I'm looking at, so Rick, which one is the knee? It's got to be the bigger one, right?
Yeah, it's the one...
Hang on, I'll bring it up for you, Rick.
The one on the left? The joint on the left of this picture that I'm looking at here?
Yes.
Okay.
Yeah. And the ankle is down to the right.
Right.
Now, the primary source document that we're taking this report from is from Sickles himself.
Right.
That he documents, he says that I was conscious of dampness along the lower part of my right leg. I was then conscious of, I lifted it carefully over my horse's neck and slid to the ground. No kidding. But he talks about being shot in two places, above the knee and then below the knee as well.
Looked at it carefully over my horse's neck.
Mm-hmm.
Does that almost look like maybe the horse rolled on top of him and broke the lower part, like the tip fib?
Oh.
That certainly could explain that injury, but I'm not sure that there was much or any injury sustained by his horse.
If the
I'm
projectile,
thinking just the sheer amount of energy going through his leg. He is attached to the horse. I mean,
Help me, boys. The horse's name, Old Grape and...
Yeah, I don't...
Grape and Canister.
Grape and Canister is his horse. I think it's...
Ironic.
Yeah. I know.
But now, what about so the bigger bone is the tibia?
We're looking at the tibia. Yeah. The fibula is the little bone.
Okay, so the tibia could have been broken by the projectile, and then if the horse or the horse fell on him, then what was the smaller one?
The fibula.
The fibula could have broken because there was nothing else to support the weight, and so that would have just snapped.
Well, whatever broke the tibia, the bigger bone, also broke the fibula. The same thing. That's all the same energy.
Okay.
So, Rick, if I hate to interrupt you.
No, that's okay.
Could, if a, let's say a 12-pound solid shot hit him in the femur, right, just above the knee, could that have imparted enough energy through his knee joint into the tibia and fibula
to shatter
to break them? Like if he had weight on that leg when it happened, if he was pushing up on the stirrup.
I would say, looking at the specimen, the fact that there's not more damage up into the knee joint, that's unlikely.
Okay.
If this was a continuum of energy going down from the end of its thigh bone or femur into the leg where the fracture is, there should be the whole upper end of the bone should be shattered, it's not.
And the accounts that we have name a solid shot, there's no shell mentioned or anything. Because
I can't swear to that.
Okay. Because imagine if a shell exploded, you could get two chunks. One hits you above, one hits you below.
Absolutely.
But not the horse. That's the weird part.
Unless it was just random that two fairly large pieces of of shrapnel.
Yeah.
One sliced through the thigh and through the femur, and one does what we see to the tibia and the fibula, and they just don't happen to hit the horse. That all seems pretty unlikely.
I mean, who knows with all that shit flying through the air,
Right. But Rick, if this was a motorcycle accident, you could put him back together if.
Yeah, we could put that back together. You can reconstruct the bony injury without a lot of difficulty. The key is whether there's any nerve damage to the leg. If the motorcycle accident, what's that?
And blood supply.
And blood supply. You can restore blood supply by just repairing the vessels or putting what's called a shunt in to get the blood going back down. The thing you can't fix is nerve damage. Yeah. And if the nerves are damaged at the time of this gunshot wound to the point that General Sickles has no feeling on the bottom of his foot, he's going to end up with a leg that's amputated later on because he can't function that way. Right. So even today, that's one of the criteria we use, whether we proceed to an amputation if somebody's got a badly mangled leg from a motorcycle accident. If you don't have any feeling in your foot, that's not going to work. And if you don't have any feeling, you're going to get sores and you're going to end up with an amputation in 6 months, 9 months, a year.
Right, okay. All right, so is that it for Sickles, or do we have more?
Oh, does the Sickles story ever end?
It never,
that's enough for now.
It never seems to freaking
Depends
end.
on which show we're on.
Okay, so next one, another famous Confederate brigadier, Barksdale, William Barksdale.
William Barksdale is an interesting story. When you read the historical facts of William Barksdale, the mechanism of injury is he died from multiple bullet wounds to the left leg, fracture of the left leg, and a penetrating missile injury to his left chest, basically under the left breast. Now, he's a general. He's
corpulent.
He's corpulent. You always hear about his weight. He's big. He's corpulent.
He wears a toupee.
Big guy. He's an attorney. He's a representative in Congress. He was a captain in the Mexican War. Report of injuries at the time, okay? And first of all, he's going to die on July 2nd or 3rd, on the night of July 2nd in the early morning hours of July 3rd. He shot reportedly 9 times, and it's rumored that a federal captain ordered the entire company to bring him down. So that's stuff we can't confirm. He's hit at least 3 times. If he was shot 9 times, we have good documentation that he was hit 3 times and probably had his lung punctured. He could have been shot maybe a dozen times or more. I mean, welcome to the Civil War.
Yeah, right.
Everybody on the battlefield killed William Barksdale. Get to it. So now we go to...
I heard he was shot 372 times.
Yeah, everything but his
He
right
is corpulent.
and he's corpulent.
And he wears a wig.
We have a couple primary source reports. Private David Parker, the 14th Vermont, and musician Robert Cassidy, 148th, sent letters to their wives. And here's what they said, excerpts. We pulled him from an area west of Plum Run on the battlefield around midnight. We attempted to give him water from a canteen, but the general could not sit up enough to drink anyway. But when he did drink the water came out of his chest wound. Now, Cassidy's going to stay with Barksdale through the night. He'll be taken to the Hummelblaw farm. He'll start to feed him with a spoon. So that's one thing that's making us think like, oh, that's kind of interesting. He's swallowing water, and it's coming out of the wound.
Well, can we pause there real quick?
Yeah.
Okay, so you're saying that they say that the bullet went into the left chest, but not directly. Like, do we know where?
Well, that's where the story's.
Oh, okay.
And if it went in the left chest, first conclusion is maybe it went through his heart. If it went through his heart, he's dead.
Oh, he's dead.
Right.
Yeah.
So it didn't do that.
Right. But so I guess my question is, how? Okay, if it went in to the point where when he drinks, it's coming out, that means it had to have ruptured the esophagus,
yes,
right?
That's right.
So wouldn't you know that before you give the guy, like, wouldn't he be showing signs of a ruptured esophagus somehow?
if he was just shot in the chest, all the patient knows is I've been shot in the chest, but I'm still alive.
Okay.
He can't discern whether he might be aware that he's not swallowing very well.
Right, that's what I'm
but
talking about.
If he's shot through the trachea or the windpipe, which is right next to the esophagus,
different.
He's not going to be able to talk.
So that you're doing exactly what Rick and I do. So he's got an esophageal injury for sure, and he's talking. So it's not high in the chest.
Right, it's low.
Lower in the chest, right? So luckily for us, there's a surgeon at the Hummelbach Farm named Alfred Thorley Hamilton, A.T. Hamilton of the 148th. Here's his report of General Barksdale. My examination found wounds in the corpulent, bald Barksdale's left chest, through his short, round jacket, whose sleeves were trimmed in gold braid, and his left leg, whose torn trousers were also trimmed in gold. Barksdale's blood was spraying from the chest wound with every breath he took. All that could be done was done for him with morphine and pain. And then he goes on and writes another one, and this is the one where historians go, wait a minute, read it slowly. But he writes again. He says, I was the only medical officer at the center front during the 2nd and 3rd day of July. I attended General William Barksdale of Mississippi. Now here it comes. He was shot through the left breast, and then you get down to the next line, from behind, and fractured broken leg in 2 missiles. So once Rick and I read that, we started saying, wait, read it again. Shot from behind. Now it makes sense.
Yeah.
The lead balls can form. If he's shot from behind, it hits a structure, the rib cage, the spinal cord. It molds the bullet, and then it takes a trajectory going out under the left breast.
It basically deflects off of another structure.
Right,
and Rick will tell you, how do you survive a chest wound? You got to be damn lucky that the heart's contracted when the bullet goes through.
Right, or it doesn't hit a major blood vessel.
Yeah.
And the lungs are pretty much air anyhow. So he's shot from behind. Now, when I take this to trauma surgeons, as soon as you show it to trauma surgeons, when they read that a gaping wound to the left chest, they said, that's an exit wound. Where's the entry wound? They don't even read the stuff. They go, where did the bullet come in?
Right, okay.
So the wound under his left breast is an exit wound.
It's an exit. But so we don't know where the entrance on the back was.
From behind.
But just know from behind.
Right.
From behind.
So now look, I see the look in your face. Is he running? Maybe. Is he running? Probably not. Is he shot from behind like Reynolds? Was he shot from behind or the front? But his wound's not a left wound, it's the exit wound, which when Rick and I looked, we went to some high-end historians and said, look, is this correct? And the one said, I gave you the book. And I opened up the book. I said, here's the report. It says, gaping wound under the left breast. I go to the next line. From behind. Yeah. That's how they answer it. So Barksdale, again, he's kind of interesting. The chest wound's too large to be made by a mini ball. If it was, Rick's right. He's dead. That energy would have burst his heart into Bennett. The fracture and 2 wounds of the legs, those probably
there's really not much written specifically about that, so we don't know it to the level that we know, like Sickles injury.
I wonder if, though, the whole, all we ever hear about is that it was the left breast that he got hit in. I wonder if that is somehow related to the lost cause, and how we're just going to gloss over the whole from behind part, because the implication is that one of his own men shot him or he was running from the enemy. Either one, I wouldn't believe. I would think he's probably turning around saying, come on, boys, and he gets shot in the back.
That's what I have to believe. I don't think William Barksdale has shown any instance where he's going to run away.
Right. But do we know, do his men hate him or do they love him?
I'm not aware that
I think they love him too. Right. So why would they shoot him in the back?
Right. I think he had to have been turned on the horse, and who knows, like we talked about with the cannonball and Sickles, what angle the missile is coming in. But it's kind of problematic, again, to what you said, Matt, the lost cause. Nobody really wants to be shot from behind. No. Because the implication is just that we're sitting here talking about. But people get turned around, missiles go in a million directions.
This is what I'm saying. A battle is chaos. Right. And a leader like Barksdale, a fire guy like him, he's not in the back. He's up front. He's on a horse. And he's doing everything he can to get his men to come with him and really fight. I would imagine at one point or another he would turn at least halfway around. And that, and that would make sense to me.
And he's corpulent, so he's got to turn a long way around.
And he's got to get that wig out of his eyes.
he's able to speak. So in his periods of lucency, he's still a general. Longstreet's coming up tomorrow. You know, Jedi warriors are coming up up Baltimore Pike. He's doing it. But the sad thing is, Lieutenant George Benedict reports seeing him on the morning of July 3rd. He died alone, sometimes over the night, with open, unblinking eyes, laid uncovered in the sunshine. He laid alone, without a comrade there to brush the flies away from his corpse. His souvenir pickers had gone over the body and taken buttons and ribbons, and there he died. Now, General Barksdale, just to say it, he's buried on the farm.
At the Hummelbaugh Farm.
Hummelbaugh Farm. He's buried by another guy named William Forster and a third private that we don't know. Nobody knows where he's buried. Now, his wife will come back to claim the body, and supposedly she brings Barksdale's dog, and the dog refuses to leave and cries at Gettysburg. Oh. So it's kind of a cool thing. Now, have you had Dean Schultz on here?
No, I bumped into Dean on Little Round Top, and I had talked to him before about coming on, and he said, I don't want. He seemed to indicate that he's not into that type of stuff. But I saw him again on Little Round Top, and I said, I asked you this before, and you were kind of wishy-washy. And I said, but I really think, for posterity's sake, we need to get you recorded in an interview, and I would like to do it. He goes, oh, all right, you know. And I said, I always see you checking your mail on Baltimore Pike. So next time I see you, I'm going to stop by and we'll talk more.
Right.
But every time I see him, I'm on the way to work.
So Dean, I took a tour with him, and he taught me how to dowse. You know what dowsing is?
The dowsing rods, yeah.
Well, yeah, but he uses two bent metal.
Like they have the ghost stores.
He taught me how to dowse. So I brought Rick out, and I said, let's try to find these. And I taught you how to dowse. And by God, we think we found the 3 graves. We won't tell you where they are because it's not historically correct.
Right.
But it's a weird thing that he was buried there. We know the guy that was buried beside him, but the dowsing rods make a move.
Can we go and do that in secret?
Yeah.
Yeah, because I want to say, I'm curious how that works.
Yeah.
Well, I was very skeptical, thought it was just this much BS. It really happened.
Really?
Yeah, it did.
Yeah, because I've seen them, the ghost tours use them.
Yeah, we'll do it.
And I'm like, those are bullshit.
And Dean's hilarious when he taught me how to do it. Supposedly there's a YouTube guide that taught him, that you can get on. He said, Dean, with that thing, he said, if you don't think you know how to do it, go to a cemetery. There's bodies everywhere. You can dowse all you want. I love you, Dean. So Williams Barksdale, dies of his wounds, but he's shot in the back. And we're not saying anything that he's a coward.
Right.
We're just saying that's his wound.
That's the way it goes.
Right.
All right. Now, the next one's interesting. Grandfather, great-grandfather of President Nixon.
Great-grandfather.
Great-grandfather,
Yeah,
George
Nixon.
from Ohio, right?
From Ohio, yeah.
George Nixon, not a general. Private George Nixon, in his 40s, if I recall, right?
Yeah, and one of the reasons that I think George Nixon is in the Army at age 42, 47, he's got 9 kids. And I think that probably motivated him to join the Army.
That.
Yeah, absolutely.
So George Nixon is with an Ohio unit who fights on July 2nd out on what's now Fairview Avenue behind the hospital, where there's a lot of intense skirmishing. We tend to think of skirmishing as, pot shots. I mean, it was pretty bloody with a lot of casualties out there.
Yeah.
And on the afternoon of July 2nd, George Nixon is shot in the hip. Now, to an orthopedic surgeon, I never know what that means. Does that mean the bullet went in and went through the bone and he can't walk?
It usually means we're going to work through the night, buddy.
Yeah, it does. It does.
When the helicopter lands and the news reporters all leave and talking to the pilots, then there's the work to put him in.
Right. Or is he shot up into the pelvis and it gets into the bladder, the rectum? I mean, they can be devastating injuries or they can be minor injuries. But Nixon couldn't walk after he was shot, and he was in severe, severe pain. And he laid out in the sun on July 2nd screaming for help, and many people know the story. His buddy, who's a musician, Richard Enderlin, hears Nixon's crying, and he tries to get permission to go rescue Nixon, and their commanding officer won't let him. It's too dangerous. Well, finally, Enderlin wins, and by persistence, he goes out, he crawls out to Nixon and pulls him back to Cemetery Hill, and they send George Nixon to the Spangler Barn, and he dies, I think on July 10th or 12th, but he dies many days after the injury. So that tells me he didn't die right away from a blood vessel injury or a pulmonary embolism. He died of an infection. It takes days for that to get going and get underway. But in the day and age of no antibiotics, there's no way to counter that. And especially if it's inside the pelvis or deep inside the hip socket or that area, there's really no surviving that. A couple of years ago, one of the politicians in Washington was shot in the hip at a baseball game.
Yes, I remember that.
And if you saw the footage of him coming back onto the floor of Congress after 3 emergency surgeries, you could see that the sequelae of that was still permanent nerve damage in his leg. And even nowadays, that type of an injury will often require multiple surgeries to get infection under control and restore bony injuries or blood vessel injuries. It can be a pretty devastating.
And he was kind of swinging that leg. That's what they describe it. He kind of throws the leg.
Yeah.
Like a peg leg a pirate would do.
Because you don't have nerve control of the leg.
Are you talking George Nixon or the Republican?
Steve Scalise.
Yeah. So, and then that's a long way for his buddy. It was just one guy that went out to rescue him?
Yeah.
And he dragged him back or carried him?
That's what I understand. He crawled out on his belly and his hands and knees and put Nixon on his back and pulled him from where the hospital is back up to Cemetery Hill.
That's a distance when you're dragging somebody.
Yeah, that's why Enderlin was awarded the Medal of Honor for that action.
Good for him.
Yeah.
So, okay, so...
what do you think the first thing Enderlin said when he got to George Nixon is the Confederates were still shooting at him?
What?
Stop screaming.
You're drawing attention to us.
Shut your mouth. All right. Let's see. What else here? What else do we have? Okay. Here. This one. Hood. General Hood.
Yeah. John Bell Hood. Division commander under Longstreet in the 1st Corps. Born in Kentucky, but most commonly associated with command of the Texas Brigade. Now he's at division command. And as the people who listen to this podcast know, Longstreet and Hood had a significant disagreement on July 2nd as to what direction they were going to go in. Hood strikes out straight south of the Peach Orchard, headed towards the Round Tops, somewhere down around the Bushman Farm, which is right behind the picnic area, behind the South End Guide Station. Mm-hmm. John Bell Hood is hit in the arm, and it takes him out of the battle. And if I asked everybody in this room, not counting Fran,
so me and Eric.
Yeah, what happened to John Bell Hood at Gettysburg, you guys would tell me, well, it's pretty common knowledge that his left arm was crippled and was never usable again.
Right.
Yeah, that's completely wrong. And the reason we know this is a few years ago, now probably 10 years ago, a relative of John Bell Hood, Stephen Hood, was privy to a case of letters in a relative's attic that included the medical records of his surgery at Gettysburg. And as an orthopedic surgeon, I'm reading Stephen Hood's book where he's reproduced the operative report. Every time we do a surgery, we dictate a long report about what we did exactly. And it's just factual. It's like Sergeant Friday, just the facts, ma'am. Just the facts. As I'm reading through this, as a guy who does elbow surgery, I'm thinking, this doesn't match up at all with what my understanding of his injury was. If you go back to any biography of Hood in the last 100 years, his arm was mangled, shattered, useless, and that's not at all what happened. He was hit by a piece of shrapnel. It entered his arm on the top of the arm.
Remember, we're on radio. Be more descriptive.
I know. On the top of the arm in the front, and came out near his funny bone and sliced right through the arm there. And it took out part of the bone that was in his upper forearm.
Okay.
The radius.
It didn't shatter his elbow. It just took out about 3 inches of bone.
Okay.
Okay. He did and these accounts are repeated more than once, he reeled in the saddle and collapsed. Now, you're not going to die from that wound. You're not going to bleed to death from that wound. I have to believe that was a reaction. Most of us have slammed our thumb in a car door or something. He got what we call vagal. He got lightheaded and almost fainted, maybe from the pain.
Sure.
Now, remember, this guy gets his femur broken 3 months later down at Chickamauga, and he lays on the ground and gives orders.
Yeah.
So I think it was his reaction to getting hit on that instance. He's taken off the field. He's taken to the plank farm over on the other side of Willoughby Run. The doctor who takes care of him does surgery. Now, it's his general hood. So he gets 3 or 4 people to look at the wound and say, what do you think? Do we need to amputate? And they all agree, no, this doesn't need to be amputated. So they did what's called a resection. They removed the damaged portion of the bone.
Okay.
And they only removed, there's 2 bones in the forearm. They removed part of the upper portion of the radius, the thumb-sided forearm bone.
Gotcha. Is that the thicker one?
At the elbow, it's about the same as the ulna, the other bone. By removing that piece of that bone, and they took off the bone up to the elbow joint, he still is able to move his elbow up and down with no problem, and he loses some forearm rotation because of that missing bone.
Can't play hockey.
Hoser. But his hand works completely normally.
Okay.
And we know this because on December 24th of 1863, the doctor who did his surgery, his name is Darby, does a physical exam to release Hood back to work. And remember, in the meantime, he's had his leg amputated down at Chickamauga.
Right.
But his arm works 95% normally. And he's got normal hand function. And when you go back through the biographies, and what this taught me is we've all seen that term historiography. Mm-hmm. What was written once gets repeated, gets repeated. When you go all the way back to the original sources, the medical injury to Hood's elbow is not at all what we perceive nowadays. He had pretty much normal use of that arm.
That's interesting.
Yeah.
That is very interesting.
And he could use crutches and as an amputee, so he could grip with his hands and he could move his arms. So he didn't have a useless arm. I always thought of him as like this Monty Python-esque figure with, I'm not quite dead yet. My arm doesn't work. I've lost a leg. But his arm did work.
It's only a flesh wound.
Yeah. What are you going to do, bleed on me?
Oh,
no,
God.
so that's interesting only in the fact that it's not nearly what we all think. And, that morphs into, he's got to be a narcotics addict. He ordered the charge of Franklin.
Yeah.
And none of that is really true.
No. Oh, I don't have it plugged in. Damn it. I had a hood line all freaking... forget it. All right, who are we going on to next? Let's see. Oh, now this one's interesting here. This isn't a Gettysburg death, this guy, right?
Right.
He died later, but Freeman McGilvery.
Rick, if he's right, we don't really have to
No,
talk
we
about it.
do. The world needs to know about Freeman McGilvery's case, Fran.
So the medical and surgical history of the War Rebellion, 90,000 surgeries are performed, only 72 deaths directly related to anesthesia. Freeman McGilvery is one of them, which is why Rick wants to do it. He'll tell you that in the operating room, when a patient does something wrong, it's who discovers it first gets to blame the other specialist.
Of course.
So if Rick says, anesthesia, they're moving, damn it, I know that. But if they're moving, I say, what did you just touch down there? It's moving. And Rick goes, move the clamp. But Freeman McGilvery's an interesting case. He's here at Gettysburg. He's 41. He's a ship captain prior to the Civil War. He's the guy that forms the famous Plum Run line on July 2nd and then blasts the hell out of the Confederates on July 3rd. He's promoted to a colonel in September of 1863, and in May of 1864, he replaces Robert O. Tyler, commanding the Artillery Reserve, in that famous ghost train of artillery reserve that we hear about all the time. On August 9th, 1864, he's promoted to Chief of Artillery for the new 10th Corps, and he is in a battle at a place called Deep Bottom, Virginia, around Petersburg. And disposition, it's told that he dies while under chloroform anesthesia, September 2nd, 1864. Well, we got to look into this. Here's what we know about Freeman McGilvery. He is wounded on August 16th. He's going to die on September 2nd. He is slightly wounded in the left forefinger, and I forget how we figured out the left forefinger. I think Rich Goodcoop provided that, because it would always say he was wounded in the finger, but it's his left forefinger.
His index finger.
Index finger.
Index, yeah.
And he continued his duties, but it would not heal. It would not heal, probably getting infected. He discussed the non-healing finger with Assistant Surgeon Haywood, who said that we could do the surgery. And Surgeon Clark, the medical director, said, this is going to be pretty painful. We should do this under chloroform. So he consents to the procedure on September 2nd, 1864. Now, in that procedure is an adjutant who's watching the procedure, and he sends a letter to his wife, which is a primary source document of the death of this man. Long ere this letter reaches you, you will receive a telegram announcing the death of your husband, Colonel Freeman McGilvery. I think I can fully understand the great anxiety you will naturally feel to learn all the particulars of his death. The colonel decided to have an operation performed upon the finger, which was struck at Deep Bottom 2 weeks ago, as there was little prospect of its healing in its present state. As the operation was likely to be a painful one, he was advised with Assistant Surgeon Haywood and Surgeon Clark, the medical director, and concluded and decided to be put under the influence of chloroform, the anesthetic, an unhappy decision that cost him his life. Yesterday, about 4:30 p.m., the surgeon came in, made all the preparations for the operation. Chloroform was administered, and after a little incoherent talking, the colonel dropped off seemingly into a deep sleep. His breathing was regular and natural, and his pulse was steady and strong as ever. Just as Dr. Haywood had removed the bandages, he was stopped from the examination by Dr. Clark, who was administering the anesthesia. The colonel's breathing had suddenly stopped. Artificial respiration is once performed. We can talk about what that looked like back then. And the usual respirations were restored, but he died, and his life had fled forever. Effort that could be made to save his life was made. I assure you, madam, nothing was left undone that could possibly change it forever. Both surgeons and the members of the colonel's staff made every exhaustion to return him to life. He had the best. You have my sympathies. So when you look at this, deaths from anesthesia occur, but they're very rare nowadays because we have a lot of instrumentation watching you. So the first thing, when you look at this, Rick will tell you that when you operate on a patient, they have to be deep enough asleep. If they're not asleep deep enough and you startle them, you can stop their heart, cause them to scream out in pain. So that was the first thing I thought. But when you read the first-hand account, he's just undressing the wound, and he's been messing with this the whole time. So it keeps going on to that point. Well, did he have a vagal response to this? Well, that's possible, except...
No, vagal response is what?
Vagal response would be something that slows your heart down.
Okay.
If you're not asleep enough...
When you faint from...
Does that have to do with the vagus nerve?
Correct.
It is.
Okay.
Yeah, it
Correct.
slows your heart rate
Correct.
and you pass out.
Got it. Okay.
We see that in the OR a lot, but we see it on the heart monitor, and we have a drug called atropine. We can bring it up, and the surgeons know to stop. If we say stop. And
If we don't know, they tell us.
say, please stop, and they look up at the monitor, and everybody sees it going flat or just a couple blips, and they know that the swamp is draining, and so we see that. So that was my first thought. It was vagal. Well, then the next thing was, well, perhaps he got too much anesthesia. Now, you understand anesthesia is a drug overdose. I'm basically controlled drug overdose. I'm making you unconscious so that Rick can do things that are pretty unpleasant to have done to you. Can you get too much? Maybe in today's anesthesia you can, but most anesthetic work at a percentage of like 1% of the air that you breathe in. You only need 16%. You need 5% to breathe. You exhale 16% oxygen. The atmosphere around you is only 21% oxygen. We're only using 1%. Great reserve in there to do it. Could he get too much today? But back then, probably not. Ether and chloroform are liquids that are poured onto a cloth or a medium that turns them into a vapor, like gasoline vapors in a car. When you breathe them in with this type of anesthetic, you will stop breathing before you die. And when you stop breathing, you wake up. So there are a high margin of safety. So it's very, very hard to think that he was overdosed. Now, if you give him anesthesia and he'd been grievously wounded and had a lot of blood loss, okay, maybe.
Yeah, but that's not what.
He's got a banged up finger.
He's got an
for God's
infected
sake.
sore finger.
He's got an infected the person giving anesthesia messed up. Okay, well, I guess that's possible, except this is the medical director. Maybe there was a guy that didn't know how to hold his airway open so he could breathe. We thought about that.
But you said earlier, Fran, there's only less than 100 anesthetic deaths and 70,000 surgeries. Right. It's hard to screw up the anesthetic.
It's hard. It's hard to screw it up. So then it's getting crazy, and the process of achieving surgical anesthesia, all that stuff. But then we kept going back to the colonel's breathing suddenly stopped, okay? This took some research, and I found an obscure article, but there's a problem with chloroform from 1864 and ether and modern anesthesia today. Back then and today, they come in light, sensitive containers.
Okay.
All right? They metal or dark brown glass, like high-end beer.
Right.
Because these chemicals are liquids that vaporize. They turn into a gas at room temperature, but they also degrade if they're exposed to the air or if they're let out too long. With that being under, we said, well, is there something wrong with his chloroform? Well, it's 2 weeks after the battle, so there's not back-to-back-to-back surgeries occurring anymore. He's going to go late in the day, so if they did some surgery in the morning, he probably had a chloroform bottle that was left open or an ether, a rag that was doing the ether chloroform that was laid out in the hot sun and drying, and it degrades the chloroform. Well, this article we found said and it was a doctor from Lancaster. Somewhere in this notes I have his name. If I get it, I'll scream it out. But when chloroform degrades, it turns into a gas that was very popular in World War I, phosgene. Phosgene is the nerve gas of World War I. And the deaths from phosgene are reported exactly like Freeman McGilvery.
Really?
You're fine, and you
dead.
stop breathing, and you're dead. And so we can put all that together, but there's a good chance that most of those anesthetic deaths were phosgene gas.
Yeah, I love this. You have to come from the medical field to even begin to ask these questions, let alone figure out these, come up with these answers.
But phosgene is a breakdown product
of
chloroform when it's exposed to light. And
that's exactly how the Germans made it. First you make chloroform, then you let it degrade into the phosgene gas, then you put it into a carrier medium that it goes out over the World War I battlefields, and it's heavier, right? It goes into the
sinks down into the trenches.
Yeah.
Huh.
So we think
that is cool.
Poison.
You can't make this stuff up.
No, you
now,
can't.
Now, they talk about
Science.
We tried to resuscitate him. So that made us look into CPR.
Okay.
They don't have CPR in the Civil War. Yeah. They have a thing called the Marshall Hall method of artificial breathing.
Okay.
So here's how you get your Marshall Hall card.
You want Eric to get on the floor so you can demonstrate on him?
Your MH.
Eric, don't.
Your MHR. This is probably what was used to resuscitate. To perform this, the patient is placed on a prone position, means face down on their belly, and then rolled side to side 16 times a minute, applying pressure to the back each time they come to the prone position. And Rick, it didn't work.
It didn't work.
I can't imagine why. I've seen that, though. I've seen that depicted in movies and stuff, and I always thought it was like a comedic thing.
No, it was a real thing.
Like when they have somebody and they take their legs and push them to and then and then it turns into the thing with
listen, everybody listening to this, I know tonight you're going to lie in your bed on your belly and you're going to roll left to right, and if you do it, you'll feel air passively moving in and out of your lungs. So it's not totally crazy. Just be sure you warn whoever you're sleeping with while you're doing it so they don't call the ambulance you're having a seizure.
This is 1863.
Right.
Okay. I mean, we're still learning an awful lot as we go along.
Yeah.
But so there were, you go back in old medicine, right? And there's all these weird things that we look at now, like that version of resuscitation or whatever. And we go, well, what the hell were they thinking, right? But it had to have produced some kind of positive results for people to think this works, like leeches or bleeding in general, right? Like it had to have done something.
We still use leeches.
Yeah.
Yeah, but isn't it different purposes now? Like
Okay, Rick, it's time for the maggot leech discussion. Your specialty.
But it's not to remove humors from the blood.
Right.
You guys don't buy into that stuff. But like, it has a different purpose than it did back then. But it must have done something, and it must have been a coincidence, probably.
It may have been, and if that type of technique or any type of technique is applied to somebody who passes out because of pain or a vagal reaction that Fran was talking about, you'll roll them from side to side, and then they'll wake up and you'll think, oh, hell, that worked.
Yeah, because they're not out.
Right. But if somebody's heart really stops, you're not going to restart it by rolling them from side to side. And, I mean, as we know, in modern day, CPR doesn't always successfully do that either. But it's kind of a cause and effect thing back then. There's not a lot of science to, well, we did this to 800 people, 400 this way, 400 this. It was kind of, well, we did this, and this is what happened, so we'll just keep doing it.
Yeah. Somebody told me, and I have no reason to doubt them, but I just want to confirm it, that with CPR, modern CPR, like if you're revived from, CPR, oftentimes within a year or two, you'll die anyway, because probably you were meant to die and the CPR just kind of bought you a little more time. Have you heard that?
As a bone surgeon, you don't need to take these cardiovascular statistics from me, but it has been pretty well shown that if you have a witness cardiac arrest out on the street and CPR is started, the results aren't always that great. And probably you had the heart attack because there's an underlying reason, and within a year, those reasons are going to probably snowball.
Right. So if you get the CPR and it revives you, and you don't, if you go to the doctor and he's like, yeah, well, you've got a major blockage, you need to get that out, and you go, I'll be fine. You'll eventually you'll die.
You're going to need CPR again.
Yeah, you will.
Yeah. And Eric will tell you, hi, Eric, they change CPR about every 10 minutes.
Oh, yeah, they do.
It used to be 5 to 1, 15 to 2. Now it's just compression, breath. They're doing M&Ms and going over this stuff.
All right. We got two more guys, but before we get to the next guy, let's talk really quick about anesthetic phases and the different phases that you go through.
So we talked, and McGilvery, that's where we started. I tell everybody, you go through anesthesia every night. You're wide awake, then you get in bed. You're not awake, you're not asleep. You're kind of drifting off to sleep. But if somebody comes in and throws a glass of cold water in your face or snaps the light on and you're startled awake, then you drift off to sleep. But then you get into the really deep sleep, REM sleep, which everybody needs. And the U.S. military says it's now a requirement after water is REM sleep. Then as the morning comes along, you start to come into light sleep, and then you start to come back where you're not awake, not asleep, and if I go snap the light on or your alarm clock goes off, it startles you awake. Those phases occur with anesthesia. We do them chemically. So when we started looking at Freeman McGilvery, my first thought was that, well, they started operating on him when he was in those those hyperexcitability phases of anesthesia or sleep. And a small stimulus is enough to stop your heart. That's what I thought happened. So we do that today. We use drugs to get you over that phase of excitement. It used to be Pentothal. Today it's Diprivan. You're wide awake. We give you a shot of Diprivan. You're unconscious, but only for about 60 to 90 seconds. If we don't turn on an anesthetic or give you more Diprivan, you'll come snapping right awake. And it's kind of funny. We all knew that those hyperexcitability phases are dangerous. The problem is when you're waking a patient up, you got to be sure that everybody's done. Right? What do we tell you, Rick? You got to be finished. You can't be putting in 3 more sutures or writing a splint. We have to wait till you're done because we're going to bring you up out of that spot where somebody, I don't know, we've seen it. They drop a pan, taking a pan off, and I get all these arrhythmias on a machine that we have to take care of. In World War II, before Diprivan, they used a drug, some of you will remember, Pentothal. Thiopentothal. It was available at Pearl Harbor. Most of the deaths at Pearl Harbor are attributed to Pentothal.
Really?
They didn't know that drug does not mix well if you don't have blood volume. And,
so
you can look up Pentothal in Pearl Harbor, but that's from M&M going, why are, this Pentothal is the greatest thing. And then they started looking and saying, well, it works on people who have a normal blood volume. Right. And now it started with resuscitation. That's how, unfortunately, every war advances medicine.
And M&M figured that out, the rapper.
Well, you know what? They sit there like, you don't want to kill somebody. Yeah, M&M, the red ones.
All right. So the next guy we're going to get to here because we have to wrap this up soon. William Dorsey Pender, another Confederate general, Major General this time.
Yeah. Dorsey Pender's division commander in A.P. Hill's 3rd Corps here at Gettysburg. Robert E. Lee felt the loss of Dorsey Pender significantly. We'll talk about his injury here in just a minute. But Lee said this: "I ought not to have fought the Battle of Gettysburg. It was a mistake. But the stakes were so great I was compelled to play, for had we succeeded, Harrisburg, Baltimore, and Washington were in our hands, and we would have succeeded had General Pender lived." So Lee felt this loss strongly. Dorsey Pender's troops on day 1 perform magnificently. They roll the Union Army off of Seminary Ridge. On day 2, in the afternoon, General Pender is over on Seminary Ridge, kind of between where the Armory and the McMillan House is. And an artillery bombardment starts down at the other end of the field. And Dorsey Pender turns to his staff officer, Joseph Engelhard, and says, "Major, this indicates an assault, and we will ride down our line." So Dorsey Pender and his staff officer are probably riding south on Seminary Ridge.
Okay.
The Union artillery start to respond, and a piece of shrapnel cuts into his leg. And Fran and I have talked about this. When you go to the reports, it's often difficult to find out whether it is right or left leg. Well, we were talking about this one day in the guide room, and when you bring something like this up, it becomes a challenge in the guide room. So within 3 minutes, we had pictures of Dorsey Pender's pants to look
A.K.A.
at.
courtesy Bob Gale.
Yeah.
Yes.
And the hole was in his left pant leg. What happened is a piece of shrapnel went into his leg, and the wound was only 2 inches. I mean, we're not talking a gaping wound.
2 joints
Right.
in your finger.
Yeah. And there's some talk that the part of the fuse of this exploding piece of ordnance may have gone in there too. But clearly what happens is he bleeds into that thigh very significantly, because on July 3rd, he can't get on a horse. He can't move his leg well enough to get onto a horse. There's no evidence that a blood vessel was cut. He just bleeds into the muscles.
What's that called? Is that a name?
Hemorrhage, hematoma.
Okay.
Yeah. And
Thought so.
That's why it's the Pickett Pettigrew Trimble charge, because Pender can't command,
Right.
and Trimble takes over his division. He's taken to one of 3 farms in the area, and General Pender decides, I don't want to stay in Gettysburg. The enemy are going to capture me. So he's put in an ambulance, and he's taken away from Gettysburg. Ambulances weren't smooth operating vehicles. There's a lot of jostling, a lot of jumping around and moving back and forth. Now, Pender actually has a servant with him by the name of Joseph, who's accompanied him north, and his brother, David Pender, with him. The ambulance heads south, and it gets down to as far as Stanton, Virginia. So that's quite a ride for anybody who's traveled down I-81. Stanton's down there.
Yeah.
Well, by this time, the leg is a mess, and now he starts to hemorrhage from the wound, a small wound, but now he's bleeding very significantly. An attempted amputation is done, and he continues to hemorrhage, and he dies.
Attempted.
Yeah, they did the amputation, but they couldn't stop the bleeding.
But it didn't work.
It didn't. He died. So when you figure the time frame there, July 2nd to his death on July 18th, that's over 2 weeks. And I think, again, when a problem happens over a period of time in the Civil War, you have to think of infection.
Yeah.
I think that hematoma got infected. That caused the main artery in the thigh, the femoral artery, to get infected. That weakens the blood vessel, and now he starts to bleed from that.
Right.
And I can tell you from experience, when you try to gain control of a infected, rotten artery to stop it from bleeding, it's like clamping off pieces of pasta
Yeah.
instead of a garden hose.
Right.
It just keeps bleeding, and I'm
Because
sure
it has no integrity,
that's
structural
exactly
integrity
right.
anymore,
Normally,
right?
an artery has some, as you said, integrity, and you can put a stitch around it and cinch it.
Yeah.
You're done. Every time you try to do that, the stitch will just cut right through the artery.
Right,
And
yeah.
they couldn't stop the bleeding, and he dies.
It kind of like turns into that foam from like when you get like snow crab legs or king crabs. This is like that
Right.
foamy,
Yeah.
you know? Or yeah, I know what you're saying.
Imagine like trying to sew a hard-boiled egg.
Right.
Yeah, yeah.
You know, and
Gross.
it kind of raises the issue. If Pender had stayed in Gettysburg and allowed disallowed himself from that, the bouncing around in 2 weeks of an ambulance,
Yeah.
might he have survived? Now he
at
would
least
have been
at least
captured
get stabilized at Gettysburg and then go.
and
you know?
avoid that complication of infection and all that jostling
Yeah.
that went along with that.
Yeah, so like along the way, every time they're stopping, they're not trying to do something. I guess they're not, right? Like,
No.
He
what
probably
can they
doesn't
do?
look that bad, do you think? I don't think he would look that bad.
He wouldn't look that bad. His thigh probably
thigh
would have been
would.
quite swollen, but there's nothing to really do about that.
Right,
If he's not
right.
bleeding from the wound, there's nothing to do.
It's all inside that is bleeding.
Yeah.
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 That sounds
So
ghastly.
it sounds like an injury that potentially could have not resulted in a fatality, but circumstances being what they were.
Now here's another one. Not here. That didn't die here. Correct? Yeah. Right. Because this was this is a suicide.
Correct. If you've ever been to the North Slope of Little Round Top, and he's the colonel of the 121st New York. His bust is on there. You can't see it till 2024, but that's where he is. And it says they held the
Theoretically.
position. Emery Upton is a very smart commander. He's going to be at West Point twice. Once as a cadet, 1857 to 1861, and then he'll be the commandant, 1870 to 1875. Upton is a deep thinker, and he has written a book on infantry tactics that was adopted by the Army August 1st, 1867, a new system of infantry tactics, double and single rank manual. Upton is a thinker, a drawer. He's probably an engineer in hiding, but he's starting to work on how to move men to win battles, and he's going to die in 1880 from a self-inflicted gunshot wound to the head. Now, a lot of talk nowadays of depression and post-traumatic stress has put, he must have died from post-traumatic stress disorder. The American Psychological Society has examined his records and where he's come, and it's just like he's going to kill himself on a Monday, common day for suicide. He's in is it the Citadel or Presidio?
The Presidio.
Presidio in San Francisco.
Yeah.
It's in March. His wife had died a year before. He wasn't able to attend her. It's usually over an anniversary of Thort. Something, a terrible disaster has come to him, and what his disaster was, he was working on a manual where you could determine the outcomes of battles based on ranks that we're fighting. So many generals versus so many generals, the outcome is this. So many captains is this. And he was thinking that he had a theory done where he could win every battle by changing the mathematical corrections or levels of commanders. The French proved that all wrong. So he gets that all around March, and on a Sunday into a Monday, he picks up a gun and puts a bullet in his head and ends his life. Now, when you look at that, I wasn't going to look at this, but he's got a good autobiography, and I'm reading it, and I start to notice a couple of weird things about him. He is a cadet from 1857 to 1861. He's always in sick bay, and there's a doctor there named William Saunders who sees him. And Upton comes in with headaches, severe headaches. And Saunders in the early says, I heard a distinct and regular throbbing in Upton's head when I put my ear to it. But it was very faint, and it didn't correspond to his heartbeat. So he could hear a noise in his head, and he said, I thought it was an aneurysm in his brain, but one I'd never heard of before. Well, Upton has chronic headaches, and when we get done with this, we're going to let Rick talk about patients he's taken care of in chronic pain. But then he becomes the commandant in 1870, and he goes back to see the same doctor, and he looks at him, and he says, I still think you've got an aneurysm in here, Emery. And he's going to follow up with other doctors because the pulsating noise, Upton says, I can hear it now. He hears a tick. in his head, kind of related to his heartbeat, kind of not. Now he's thinking, well, it could be an aneurysm. Maybe you have a brain tumor. All right. He's now starting to get discharge. I love the word, Rick.
Rhinorrhea, otorrhea,
Catarrh.
Catarrh. That's
What?
right.
Say
We're not
that into the
talking
microphone.
About the country. Catarrh is again a medical term, so you all don't know what
But
we're
what
talking about.
was the stuff before Qatar?
Oh, runny nose.
Runny nose. So he's got this running nose and this pulsating sensation, and he sends him for all this workup, and the workup in 1870 to 1875 is showing nothing. They can't prove one thing or other. Other than he's got this runny nose, everybody can hear it. Dear God, Upton can hear it. And it's in his left frontal. He can't hear it.
That would drive me crazy.
It's driving him crazy. He comes back. He goes on a European tour as a commandant. In 1880, Saunders, the doctor, sees him for the last time, and his malady's getting worse. The catarrh is worse. His nose is draining brownish red stuff, which is usually the sign of a tumor in his brain. And Upton is and this is where the psychiatrists say, he says, you cure me of this, I will give you $10,000. And Saunders says, I wish I could. I don't know what it is. He's going to send him off to a guy in Philadelphia. His name is Dr. Harrison Allen. And the diagnosis is chronic nasal catarrh with pain in the head. Upton goes down there, and catarrh is coming out, and Harrison looks at him, and here's what he writes. He says, the patient complains of a dull day's feeling about his brows and crown as if a veil is dropping over his medical faculties. I notice a bloody charcoal-colored phlegm coming out of his nose discharge. He said, I'm unable to demonstrate an aneurysm or a lesion. I can hear this noise in his head, but it's not related to the heartbeat. Rolling out aneurysm, and I don't know what this is going. He said, but I do offer him a treatment. And I'm going to have Rick explain this to him. I guess you used to do this a lot in 1880 with runny nose. You could go to a doctor and they'd give you cocaine. Or they would do this new procedure, which he's going to try
They
on
amputate the
called
nose.
galvanic cautery.
Yeah, galvanic cautery.
Yeah.
That's a medical term for burning the tissue.
So imagine a spring from a pen, connect to an electric cord, go up into your nose, and turn it on.
Is that how they did it? They used electricity for it back
Yeah,
then?
yeah.
I guess the cocaine would make it better.
I'd rather do the cocaine, yeah.
The whole idea
At least
is
you have fun.
you're going to stop the drainage
Yeah.
by burning the tissue and obstructing it from
Right.
coming out. But it doesn't take a brain surgeon to figure out that that's going to cause its own problem.
That's right.
Which
And
would be clogging.
Yeah.
Yeah.
The pressure's backing up. Upton's going to elect for these procedures September to November of 1880. And finally, he's going to go take the position at the Presidio right, in San Francisco. And the last thing Allen reports, the treatments I gave him some temporary relief, but all in all, they were generally unsuccessful. Now, he's going to go to the Presidio in 1881. He takes this in December 17th, and he's going to self-inflict a gunshot wound on March 14th, 1881. He's discovered by orderlies, and they do he's a very popular guy, and they do a formal inquest on him, and the cause of death from the inquest was death due to self-inflicted gunshot wound. That's it. So what's going on here? Captain Hasselbach said, I found him lying back on his bed. His right hand was resting on his chest, clutching an Army Colt caliber. The headboard was indented and cracked by the bullet. It had not penetrated the headboard, but bounced off the headboard and hit him back on the head of the back of it. The coroner determined that the gun was placed in his mouth, and he committed suicide. Well, geez, that's pretty good. That makes a lot of sense. But something's not right here, and this is where it starts to get crazy. The coroner's verdict, same thing. They want to protect this guy, but a couple of things don't make sense there. First of all, Upton has no report ever of being suicidal. And in fact, Saunders, the man who took care of him all those years at West Point, said he's a Christian that does not believe in suicide or hurting each other.
Okay.
All right? The second thing is his effects are found all in order. His uniform is folded like he's going to get up and go to work the next day. But then they start looking around and they start finding notes. First of all, it's letters from his wife. Then some of them are burnt in the fireplace. But then his letter of resignation says, I resign from my position. I have it here. He resigns not from the Army, but he resigns from what he's doing to work on his new system that the French disavowed. The American Psychological Society will say depression leading to suicide. The day before his death, it was reported that he had talked to an officer saying he has difficulty in completing the revision of this manual. He's a very devout religious man, and this doesn't seem to make sense. PSTD, we're going to have Rick talk about that at the end. It happens.
PTSD.
PTSD.
Yeah.
Thank you. Post-traumatic stress
I thought you were
disorder.
saying the postscript touchdown.
No.
It's like, what?
It happens in all wars. Roman centurions had it. All right.
Human beings are human beings.
Right.
We know that triggers of that it is rare, but the syndrome didn't present like that back in the Civil War. If you're looking for it, you're looking for things like nightmares, flashbacks, fears, situations, lack of sleep, paranoia, alcoholism. We don't see that in Emery Upton. We know he's got this chronic pain. So the aneurysm is rolled out. I took it to my brain surgeon. He said the guy doesn't have an aneurysm, probably not a brain tumor. But I took it to an ENT surgeon in Johnstown, and he looked at me and says he has a pseudocyst of his trephinine sinus. Now your skull has holes in it, so your head's not so heavy, and these holes are packed with a lining, and the lining secretes. That's how you get a runny nose and you get a sinus headache. When you get a sinus headache, you're having what Upton had. He said, Fran, he has a pseudocyst, which is a benign tumor that develops in the sinus above your left eye. In his case, his left eyebrow. And he said, who the hell cauterized that thing? He said, because all they did is grow the pressure, and it probably blew out into his brain. So now you've got this soldier there who's not going to commit suicide. Rick, the pain probably is just enormous when this happens.
Yeah, I'm sure it is.
It's got to be.
I didn't treat that condition because, again, I'm not an ENT surgeon.
Right.
But that type of chronic pain works on you in many, many ways. Right. And it starts to, if you weren't depressed, you're going to get depressed from the chronic pain. And it can drive you to the point of doing extreme things. Right. And I think that's what we see in Emery Upton.
Right. And like everything that Rick and I have talked about today, as humans, we want a single answer. He was depressed and committed suicide. Well, yeah, but why?
Right.
And Rick and I, when we go through these, we try to ask ourselves why 5 times. Well, why? Well, why was he depressed? Well, his wife died. Okay. His life's work was debunked. Okay. But when you start talking to Rick about chronic pain, and I don't see a lot of him he takes quinine. He says that helps.
But he's not taking cocaine and narcotics. Laudanum and opium are very available, and there's no record that he was going in that direction.
Right. Mm-hmm. So is it post-traumatic stress? Probably. But it's complicated by this chronic
this real pain. Medical, well, not real, this other medical problem that you can see nowadays on a CAT scan or an MRI. Right.
And that's what we keep telling Wayne. That's why in the PowerPoint you're looking at, there's a CAT scan, and Wayne says he's looking for it.
Yeah,
but hasn't found it yet.
We need a time machine and a CAT scanner to go back to the Civil War.
But what was the extra pulse that was not connected to the heart?
So if you think of that sinus as a hollow ball.
Okay.
And inside is this fatty thing that's surrounded by fluid.
And it's moving around.
It's bouncing around. They could hear and as soon as the ENT surgeon looked at it, God love him, he looked at me and he said, it's a pseudocyst. He said, pseudocysts never match the heart. And he said, that's the first. And I said, what would you do to fix it? He said, well, steroids and medication. But he said, worst comes to worst, we make an incision in your eyebrow so you don't see the scar. We lift it up. We take a tool and we drill a big ass hole in there, suck that stuff all out and pack it with something. And he said, go on with your life.
Yeah. But they couldn't do that back then.
No.
They
didn't have enough
They were
knowledge
treating, and I guess, Rick, that's the thing as we finish up. We look at these surgeons and say, oh, they're meatball surgeons.
Yeah.
They're state of the art.
Of course.
Someday they're going to, I tease them all the time. People are going to look back at his work 159 years from now and say, can you believe they put titanium in people?
Yeah. Once we
that,
find out it causes cancer or something. Yeah.
Why did you use that bone glue? Why didn't you invent that to just glue things back?
Or put it under an ultrasonic light with Spam and it'll grow back together.
Yeah.
No, you're right. And also the Civil War is where they learned a lot more stuff that they, it would have taken probably another couple decades to learn if we didn't have that war.
Yeah, and
So
Fran
thank
said
God
as
for the
much.
war.
It's military conflict always results in a great deal of new medical knowledge.
Yeah. All types of innovation in all fronts, right?
Absolutely. And anesthetics you're getting today were developed in the first Gulf War.
Yeah.
Where we used to give people
Right.
spinals to numb your whole body up. Now we can just do your left leg, right arm, left,
Yeah.
your hand. So it moves.
It's amazing. Guys, thank you very much for coming on and doing this. This is a presentation you've given or you're going to give?
We've given it in the
You've
past.
given it, yeah.
Yeah.
It sounds like it would be something that people would be really interested in.
It was pretty well received. We gave it to the guides just to kind of educate them. And we've got binders of other cases that we can talk about. Fran and I do a program where we walk up and down Cemetery Ridge and talk about some of the casualties up there. People like Kemper, like Garnett, like Hancock. It's pretty interesting stuff.
Well, we're going to do a bunch of shows with you over the late fall and through the winter, medical-based shows. One I'm looking forward to is amputation. Maybe we should do amputation and other common surgeries because I don't know if we could do a full. Can we do a full hour and a half on amputation?
If we start to talk about artificial limbs in conjunction with that,
that's right.
Could.
That's what we're going to do.
Yeah, but
with
it's
Tracy
a Civil
Barrett and you
War.
guys.
They don't have a hell of a lot of different operations to
No,
do.
I know. That's right. That's a good point. So we're going to do that. We got just a whole bunch of stuff that we got.
The PTSD thing, I think, could be a talk in and of itself. And as Fran said, there's a lot of new stuff about PTSD in the Civil War.
Yeah.
We're not talking about PTSD now, but how it impacted the Civil War veterans and their families.
And I think for that one, that's when Tracy Bear's going to be on with us, and he said that his pastor deals with PTSD patients today, which is great. So we'll have an expert on PTSD. Which I've been looking all over the place for. So
you don't really need an orthopedic surgeon and an anesthetist for PTSD, other than what we give people.
No, but still, a lot of these guys probably were wounded, and you guys mangled them.
And built them.
No need to
there was
thank
no
us.
billing. Depending their deductible. But and over the winter, we're going to work on diseases.
Yeah.
Because we all know two-thirds of them died of disease, not of what.
So then you're going to work on that over the winter. So spring or summer, we'll be able to record that, and that'll be fun. All right, cool. All right, well, thank you all for tuning in and listening, and I hope you really enjoyed this. I certainly did. So really, I don't care if you did. I did. So I had a good time. Thank you, guys, and thank you all for listening. We'll talk to you later. All right.
There you go.